All right, I can see participants are entering the room, attendees are entering. Wonderful. All right, well, welcome everyone. Thank you all for taking the time today to be participants in this wonderful webinar. The title of this webinar is Quality Management System, ISO 15189, to improve your operations and reduce errors. I'll give a quick little intro on Response Biomedical, the host of this webinar. There's a little overview. As many of you may know, Response Biomedical was founded back in 1991, so we're over 30 years old. We have been around here for a bit, and we are based out of Vancouver, Canada. We manufacture in-house all of our products and our systems as well. We are a privately held company, and we've designed and developed the RAMP technology. And like I mentioned, 100% manufactured here in Canada. Our products are definitely of the highest quality. We are ISO 13485 certified and NBSAP as well. Our products, I can proudly say that they are being distributed all over the world. We are quite international. We have partners across various regions. And some of our tests, especially the clinical side, are FDA cleared as well. But a little introduction on our speaker today. Definitely delighted to introduce Manuel Giraldo. He's got quite extensive background in terms of healthcare leadership. As you can see a little bit in this slide, he's worked at 3 major teaching hospitals in Toronto and here in Canada. So he'll be able to elaborate a lot and give us a lot of information in terms of quality management. One of the things I do definitely want to point out is that he was spearheading the Choose Wisely initiative back in 2012 in the United States and in 2014 here in Canada. So it's definitely something of note. I also want to mention this webinar is going to take about approximately 30 minutes for the presentation, and we will leave about 15 minutes at the end for a Q&A. There will be 2 poll questions through the presentation, so feel free to participate with those. And of course, if you have questions, please type them into the Q&A box, and we'll be able to read them out and go through them, and Manuel will be able to answer those for us. So again, I'm going to stop sharing and hand it over to Mr. Giraldo.
Well, thank you. Thank you, David. Let me just put my slides on the screen. Let's go. Let's see if we have the slides. Yeah. Sorry. Okay. So good morning, good afternoon, wherever you are. Good afternoon, good morning. My name is Manuel Giraldo, and I'm delighted to be here with you today. Speaking about quality. Quality matters. Very important. So I've been invited for this webinar, and I have a few slides for you. And also, we're going to make this very interactive. I will ask you some questions, and I'm hoping that we can all respond and that we can connect each other throughout the conversation. This is a slide that I'd like to present. This session is sponsored by Response Medical. And before I actually dig in and get into the details of the importance of a quality management system in your labs, I like us to answer 3 questions together. The first one, and you can type in on the chat if you want to participate, it'll be great. I would love to hear your comments on this. Why do you think it's important to reduce lab errors in medicine? Second question I would like to do is how to build confidence in the services that you provide. The third question is, what do patients want when they go for a blood test or pathology test? So I put the 3 questions together because some of you would like to participate or in either of them or any of them. So if you can put your comments on the chat, it'd be great. We're just going to give it only 30 seconds, 10 seconds, and if not, we'll just move forward. And I wanted to put these questions because these are the key questions that people ask when they go for testing. They want to have quality, they want to They don't want to hear about lab errors. They want to make sure that those lab results are accurate. So this is the main sort of component of this conversation today. All right. So let's talk a little bit about why this is important. And throughout the conversation, we're going to be able to respond those three questions together. You'll see throughout the slides as well. So the topic today is quality management system, and the quality management system is related to ISO 15189. And I wanted to put in brackets. I put in brackets improve operations, reduce errors, because those things translate to each other. So if we improve quality, if we improve patient safety, we'll reduce lab errors, and therefore will improve operations, and that would translate in a lot of benefits for the lab and for the people who work, and for patients and for physicians. Here's a little bit of myself. And I want to thank David for the intro. I've been working in healthcare and lab medicine for over 35 years in different capacities. In Canada, I have worked as a lab scientist in different disciplines, almost all the disciplines within the lab medicine department, and also as a manager, coordinator of quality, and later on as a director of lab medicine and genetics in one of the teaching hospitals in Toronto. As well, I participated in multiple national and international commitments or assignments, including choosing wisely and accreditation for hospitals and for labs throughout the world. Very pleased to be with you here today. These are the objectives for today's webinar. The first one is we're going to talk a little bit more about the international guidelines that we use usually in lab medicine. And then the second topic that I'd like to bring to your attention is the quality management system. We'll talk as well about the quality system essentials. Then we'll discuss the components of the quality manual. And then one of the key components will be the quality management committee. That is a very important element in any of the labs, in any organization that runs lab testing or pathology testing. And then we'll hear a little bit, we'll discuss a little bit about the feedback, the quality manual of the organization. And at the end, we have a Q&A session. So the first slide that I'd like to bring to your attention is the definition of a quality management system. And I brought today 3 different definitions. There are different ways to define quality management system. The first one is by ASQ, which is the American Society of Quality. A quality management system is defined as a formalized system that documents processes, procedures, and responsibilities for achieving quality policies and objectives. That's one of the definitions. Another definition that we have in terms of the more on the lab side is from CLSI. It's a systematic process-oriented approach in meeting quality objectives. And that's the Clinical Laboratory Standard International. It's an organization, very important organization that develops guidelines and documents related to lab medicine in all the different disciplines, not only from the quality management side, but also from the technical side. And I'm sure that many of you are aware of this international recognized organization. The last definition that I'd like to bring to your attention is the definition itself by the ISO 15189. And with this ISO, I'd like to make a bracket. I'd like to mention that ISO 15189 has released this document. The last version was released in December. So there are 2 versions previously released, and recently they released in December 2022, they released the last one. So with that in mind, the definition is general management activities, the provision, management resources, the pre-analytical examination and post-examination processes, evaluation, and continual improvement. So these are the 3 definitions that I wanted to bring to your attention, just to keep in mind, but probably you will have your own definition. You have, and you can encounter a definition by WHO, by other international organizations. So here is the foundation. The foundation is the quality management system in any lab, in any pathology department. If we don't have that foundation, it's very difficult to have a strong technical component of the 3 phases. So usually you have in a lab, you have the pre-analytical analytical, and post-analytical. But before you actually establish your all procedures within these three phases of the lab cycle, you want to ensure that you have all those quality components of your quality management system. And we're going to go into the details. So let's keep in mind this last part. A strong quality management system means less errors, more satisfaction for physicians, for customers, increased reputation, and why not improve profit for the organization. So it's a win-win for everybody. So the international guidelines that we're referring to today is mainly 15189 ISO, but ISO 15189 came from ISO 9000. Back in 2003, when ISO 15189 was released for the first version, before that was ISO 9000, which gives the general principles of a quality management system for any type of organization, not only for labs, for hospitals, for manufacture, for agriculture, for education. ISO 9000 is the principle for all these different components that we will be discussing. What happens with ISO 15189, this ISO add specific requirements for the technical, the pre-analytical, analytical, and post-analytical component of the lab medicine department. And then throughout this conversation, we'll be talking potentially about these three other organizations: WHO, the CLSI Institute, and ASQ. So before we go into the next slide, which is purely related to quality management system, I'd like you to look at this slide, and this is a brain loop slide that was released in the Journal of Quality and Patient Safety back in 2013, but it's a very, very recognized slide where you can see the components of the testing cycle, but also you'll see the different steps when after the physician placed the order. So you can see that it's not only placing the order, it also goes from collection to identification. How do we transport the sample, the preparation of the samples, the analytical part, and the reporting of those results. And those results go back to the same physician. So it's a loop, it's a cycle that repeats continuously. And at each of these elements, each of these components, we can make mistakes. And the point is, how do we reduce and how do we minimize the errors in our labs, right? This is one of the constant issues that throughout my experience working in multiple labs, I'm working as a lab scientist, I wanted always to reduce the labs. And we know by the literature that the majority of the labs occur before the specimen arrives in the lab or before the specimen is actually analyzed. So before the specimen is analyzed, we know that it's been collected, identified, and transported. And those accounts for about 70% of the total errors in the lab. And the other two components, analytical and post-analytical, will do about 30% of those total errors. So let's keep that in mind as we move forward with our conversation. I'm going to ask you this question. I would love to hear on this one your comments. So if you can actually, I think we're running a poll for this. I've been told that we're going to run a poll. So my question to you is, and you can put that in the chat again, it is about what are the key elements of a solid quality management system? So here is the poll. You can click on that. You can click on which one do you think is the answer. And then we'll see the results in 2 minutes, in a minute, after you click your answer on the preferred choice. I'm going to give it 1 second. I think we have, we're going to let the people who are running the poll to tell us the results. I know that many of you have heard about. Yes, go ahead, David.
So right now the results, a little bit toe-to-toe, but the 5 quality system essentials is at 60%.
60%, okay.
Yes,
all right.
it's leading.
That's very good. Okay, cool. All right, so we're gonna move forward now, and we're gonna discuss what are those key elements of a solid quality management system. And 5 elements is good, but the answer is the 12 quality system essentials. And we're going to go individually. We're going to review those. We're going to get into details. We're going to try to stop in some of the key elements related to equipment and to reagents. So the quality system essentials, a definition for WHO is, oh, that's good to know. Okay, 45 and 55. Very, very close to each other. Okay, thank you, David. Okay, so it is a set of coordinated activities that function as a building blocks of a quality management system. So those 12 elements that I'm going to show you on the next slide are the key, the building blocks to having a strong and solid quality management system in our labs. Let's review those 12 elements. So here are the elements. You can see the number 1 is organization, process management, customer focus, documents and records, facilities, information management, personal, non-conformities, event management or incidents, purchasing and inventory, assessments, equipment, and quality continual improvement. So these are the 12 building blocks that we must have or shall have in our labs. ISO 15189 give us a specific indication what are those international standards that are developed on evidence base, right? That were made of evidence-based medicine, that we should pay attention in terms of what are those key elements for each of these 12 components that we need to keep in mind when developing our quality management system in our lab. That's the key fundamental of ISO 15189 that will give us specific details how to build and how to develop the policies and procedures related to these elements. So I'm going to go individually. I'm going to stop in some of them, but I'm going to, at the end of the day, we're going to give you a specific guideline that you can use yourself, you can use to develop these elements in your lab, and you can use it to develop your own policies and procedures. So number 1, the first one is organization. We're going to look individually into all these elements. I'm going to stop on some of them. Because of time, the total time that we have, I won't be able to go in details for each of them, but I want to give you the headings. So the first one is organization. When you pull ISO 15189, you'll see that these are the headings or the main components for each of these elements. First one is organization. Within the organization, we want to, number 1, we're going to tell the organization, we're going to tell our customers what is our quality policy and our commitment with regards to customer service and to the quality of delivering very good quality results and testing, right? We're going to identify, describe our objectives. We're also going to discuss about the quality committee that will be helping us to ensure that everything that is happening within the lab is done properly. And we'll discuss that quality committee. We'll get back to that later. The resources that we have and communication. And then one of the specific recommendations, standards, are that we should have a quality person designated to help us to ensure that the quality and the safety components are being met on an ongoing basis. This is just not one time. The quality individual, it could be a coordinator, it could be 3 days, depending on the size of the lab. And again, I've been to labs that we have, for instance, one of the labs that I work in Toronto is a 1,000-bed hospitals. We have a quality team within the lab dedicated just to quality. If it's a small lab, it could be one quality coordinator. If it's a mid-sized lab, it could be a quality manager. In some cases, if the lab is small, it could be the same manager carry on the activities of the quality components, right? So no matter how size is your lab, your organization, you must have somebody related to this part taking and leading the conversation for the quality side. The second piece is the personnel. So that's another QSE that we must keep in mind. The personnel will tell us is about the job descriptions, the qualification, all these elements that you can see here on the screen that must be stated, must be developed. So we have to tell within this QSE, we must state and we must identify who works for in each of the disciplines that we have, what are the titles, the organizational structure that we have, and how do we onboard, how do we recruit the people, and how do we train them, and how do we ensure that they're competent to carry on the activities that they do in the lab, right? The next quality management system, the next quality system essential that I wanted to bring to your attention is the purchasing and inventory. And within this particular component or element, I like you I like to stop in supplies and reagents, because I want you to keep in mind that and I'm going to show you the next slide. On the next slide, you'll see the requirements actually from ISO. And then the next key essential is the process control. It's about method validation and method verification. So these two elements are very much related to whenever we buy reagents, equipment, or consumables, that we must comply with some international requirements. So let's go and let's look it up on the next slide to see what ISO says. Okay, so the lab, so in clause ISO 15189, version 2013, 2012, clause 4.6, external services and supply. You can see on the screen that ISO is telling us that we must have a documented procedure for the selection and purchasing of external services, equipment, reagents, and consumables. And that the lab shall select and approve the suppliers. And a list of selected and approved suppliers should be maintained, should be kept. And we should monitor the performance of the suppliers. So that means that in my lab, in my previous labs, I will have identified the suppliers that meet my needs, and also to ensure that they have the highest quality when it comes to reagents, consumable, and equipment. And how do we do that? We want to make sure that those reagents and that equipment is validated, is verified before we put into place. So we can have a separate conversation about that topic, but there is a lot that we need to ensure before we use those reagents. We need to ensure that those reagents meet the performance claims that the manufacturer will say on their insert package. And how do we do that? Doing validation studies, we run precision, accuracy, carryover, so on. The same with equipment, we ensure that the installation is done properly. And then we had to develop those documents that will tell us how to do it. And also, we must keep records. This is very important. When the assessors, when the accreditors comes to an organization to do lab accreditation, I do that on my side as well, a lot in Canada International. I will come in and I will make sure that the records of the verification and validation of reagents and equipment is being kept, that calibration is maintained. So just 2 cents of that, just to keep in mind those components. All right, the next two essentials are equipment, about purchasing, installation, validation, calibration. Let's keep in mind that I know we have equipment in our labs. That's one of the main components that we have, equipment, reagents, right? And those reagents and equipments that must be maintained, must be kept and stored. Reagents might be stored in a proper place, in a fridge, in a lab fridge. And we must document the temperature of that fridge every day, right? And with the equipment, some equipment will need PM, that's the preventive maintenance, that it will be done potentially once or twice a year, depending on the manufacturer recommendations. But also we have something called routine maintenance. Routine maintenance can be done daily, weekly, monthly, was necessary, depending on what instrument we are running, depending of the manufacturer, what recommendations we have from the manufacturer, but we must document. This is one of the pieces that people are missing. When I do my lab accreditations, I notice that a lot of people say, yes, we did the lab maintenance, we maintained the instrument, we primed the instrument, we did the shutdown. And when I ask, can I see it? Can I see the evidence? So a lot of the places we don't keep records. We must keep the records. This is one of the key components, because we must prove that what we're saying is done, right? So let's keep that in mind. Another element is the information management system. And that is about the LIS that will allow us to interface the instruments with our own hospital information system. Or if you're a standalone lab, you can interface those equipment to your lab results, and then you get the results straight flowing, the results flowing from the instrument right through the LIS, Laboratory Information System, and so you don't have to type in the results. And then I wanted to bring this ISO clause 531, just to keep in mind a little bit of what we just mentioned. It is on the ISO very clear that for equipment, we must have a documented procedure for the selection, purchasing, and management of equipment. So everything that I'm saying today is evidence-based medicine, and you can find it on the ISO, and you can find it on other international guidelines, but these are the elements that we must keep in mind, and we must develop policies and procedures for each of these elements. When it comes to reagents and consumables, the ISO is telling us that we must have a documented procedure for reception, storage, accepted testing, and inventory management of reagents and consumables. Let's move into the next quality system essentials. Documents, records, we know that this is important. It's not only preparing the documents, it's also about how do we prepare the documents to meet the requirements. And there are specific clauses and elements that we must comply. The next key essential is the occurrence management. What we must report incidents and errors within the lab, and not only lab errors when we make mistakes. It's also those incidents or non-conformances related to, for instance, a QC error, quality control error, an EQA error. How do we document that too? And what do we do? Even customer complaints will be included within occurrence management. And then the last part of this slide is about assessment. These are assessments that can be done internally or externally, and it also includes accreditation visits or inspections. So many of you will work in countries where you have a national accreditation body or international accreditation body that comes to your labs and will check everything that we're talking today, right? That's external assessment. Guess what? ISO is telling us that we should not rely only on external accreditation. We should not wait for every 3 years for somebody to come in and do an assessment. We can do this on an annual basis, and that's called internal audit, right? And here is the clause for that. Clause 4.14.1 on ISO 15189 will tell us that we must plan, implement, and the evaluation and internal audit that is needed to ensure that the pre-examination, examination, and post-examinations are meeting the international standards and ensuring conformity of the quality management system. That means that we should, and we shall, by the way, every year, we should look into what are those key elements in our quality management system that we want to audit, that we could audit with our own people. I've done this multiple times within the lab. And when I go outside for accreditation, I also ask the organizations, the labs, if they do internal audits. So we can have a separate conversation on this topic, but the bottom line here and the key learning session component here, element here, is that we must do internal audits. And there are many elements included in that in terms of training, developing the checklist, and how do we conduct the internal audits within the lab, right? But it's going to help us to maintain the high quality level in our labs. And it means that we don't have to wait for every 3 years a cycle for accreditation, for national and international. We can do this on an annual basis and maintain high quality and patient safety in our labs. The next three last components are related to quality improvement, customer service, and safety in our labs. So quality improvement is part of that is what we're doing today, is learning, is trying to adopt, to implement new elements, to continuously improve our labs. The quality improvement is not static. It's something that is continuously cycled. It's a very dynamic process where we plan, do, check, and act. This cycle will help us to understand that every time there are many activities that we can improve within our lab that we must identify, we can plan, we can create strategies to improve, and then we can analyze if those strategies work, if they're effective, and if not, we can go back to the cycle and we can continue working on that. Customer service, we need to hear from our customers, not only from our physicians, we need to also hear from our patients. We can run surveys, right? And then the last component is facilities and safety. This is a component that is very important, that is not only related to, oh yeah, we're gonna deliver great results and high quality testing in our labs. We also have to ensure that the people who work in our labs, our own technologies, our own scientists, even the people who come to see and to get blood tested and collected the blood, is also safe when they come to our labs. So that our own staff who work for us is safe. So in that case, we had to develop an emergency management process. We had to pay attention to how do we manage waste. We got to keep in mind what are the best safe practices within our labs. And there are many requirements that you have heard: long hair, jewelry, many things that you must keep in mind, the way that we wear the shoes. All of those components are very detailed on ISO 15189. And again, we can use other guidelines, but this is the most worldwide recognized guideline. And ergonomics as well, and how do we transport specimens between facilities, even within our hospital, within our own facility, how do we do that? So I have another question for you. You're gonna help me with this one. We're gonna ask the team in the head office, to run the poll. This is about where do we find the QSEs? And you can answer, you can pick, select one of these three answers, and no answer is wrong. We'll discuss it together. So please participate. We got three answers. Where do we find the quality system essentials? Are they in the quality manual? Are they in the lab manager office? Or not sure, right? So let's give it a 10 seconds and let's see the results from David. Whenever you're ready, David, you can tell us what are those answers.
And our results with an 83% score for quality manual as a choice, quality manual. 83% and 17% are not sure. So they're ready to learn.
Okay, well, that's great. That's great. And this is the purpose of this webinar today, David, and audience. It's about learning and it's about sharing best practice. And I'm happy to do this for you. So the answer to that is that we should be able to find this in policies, in our policies and procedures. And where are those policies and procedures? Well, we have a quality manual. The quality manual is the place where we keep the policies, mainly the policies related to all these elements that we discuss, these quality system essentials, all the policies and some of the procedures and some of the forms could be located here, but mainly it is about the policies that we keep. Now, these policies that we have in our quality manual will refer to quality forms, to checklists, to documents, within procedures that should be located at each of the disciplines that we have. That means that in biochemistry, hematology, microbiology, molecular, whatever, transfusion medicine, blood banking, you must have your own manual with all the technical procedures for each of these disciplines, right? How to do urea, how to do creatinine, how to do a CBC, how do I do a DAT for blood bank, how to do ABO testing, how to do Granny stain in microbiology. Those are the procedures, the technical procedures that must be developed by each of the disciplines. But they should be referred, or vice versa, to the quality manual. So how do we train people? Well, that's going to be found on the quality manual because that's for everybody. What is our policy for customer service? That's for everybody in the lab. But we're not going to keep in the quality manual. How do we do a gram stain? Because that's more for microbiology. So the quality manual is we could even call it the Bible of the lab, right? It's the Bible of one of the holy books. If you want to call it just neutral, call it the holy book in the lab where you keep all the processes and policies for the main structure that we discuss. And then at each discipline, you'll have your own technical requirements. So how do we develop? Here's the question that a lot of people ask me, Manuel, how do we develop a quality manual? Well, number one is we must designate a quality manager or individual who's going to help us to drive quality. And this person will be also responsible of developing the quality manual. Many of you already have your quality manual. Do you have all the components that we discussed? Do you have only 5 components? Do you address all the 12 elements that we discussed? So this is a job that we're going to let the quality manager to help us to ensure that we have the policies and processes for all those elements, right? Based on ISO or based on WHO, whatever the guideline that you use, the model that you use. And then I'm giving you a reference, by the way, for how to develop a quality manual. It is the WHO, and you can see a link, or you can use the QMS 01 CLSI guideline for developing your own quality manual. And then you must develop a table of content. What are the elements? What are the headings and subheadings that we're going to have on that quality manual? I'm going to show you one example of that on my next slide. And then you must develop a standard template. By the way, that's another standard. Develop a standard template for your own organization that it will be used for each of the documents that you develop within the lab, right? So let's look it up. Here is the clause related to quality manual from ISO. You must have in that manual the quality policy. You must have a description of the scope of the quality management system. You must have the quality management structure, description of roles, and you have documented policies for each of the quality elements. And everybody in the lab should have access to the quality manual, and people should review it and should be updated and reviewed periodically. Some people will do it annually. Some people will do it, define that every 2 years, but you must do it, you must review it and update it as long as you update or review or change processes within the lab. I think we have a question. Oh, here is the link. Thank you, team, for adding that link to the chat so people can just click. It's great. And here is a table of contents for a quality manual. This table is recommended or is an example coming from WHO. So you can see the elements embedded within the table of content. You can see the QSC organization, facilities, equipment. And within each of these elements, you'll have each of the sub-components that we discussed. Before that, obviously, we have the objectives, and we have the scope, the vision, the statement, everything that we discussed before on a previous slide. So this is a heading that is for you. You can use the link that David has provided on the chat, and you can create your own quality manual. And it will be a template, by the way. They will have a template for you that you can use to develop and insert your organization, and you can use to customize to your own policies and procedures. Let's move on because we're very close to the end. So I want to close almost the conversation by giving you a slide that it will tell you the key components of having a strong management system in your lab. And remember that slide, the first one that we said, okay, if we have a strong quality management, we're going to see less errors. We're going to see more increased customer satisfaction, physician satisfaction, and we're going to see more benefits for the lab, for everybody within the lab, because we got to be certain at the end of the day, you and me, when we work in the lab, we want to go home and we're going to have a good sleep. We're going to go home, we're going to say, okay, you know what, I did my job. I'm certain that everything that I ran today in my lab was done properly. I follow the standards, I follow the procedure, I ran my QC, I have a good equipment, I have a great reagents, I did everything that I could to save the life of a patient who was in an emergency because he had a heart attack, right? Or a cancer case that was never identified. You were responsible for that because you have a high quality and you have a strong quality management system. Remember, lab testing, 70% of the medical decisions come from you, from your labs, from lab medicine, right? So here is the summary of my today's talk. Number one, if we want to have a strong quality management system, we need to develop those quality system essentials, right? If we have 5, we have 6, we gotta look at the standards. We gotta look at which parts are missing. We gotta add to it. We must appoint a quality individual. Depending on the size of your organization, we can decide how the commitment. Is it a full-time, part-time? Is it the same manager if it's too small, the lab? Or if it's a big lab, do I need more people in that quality role, right? And then we are looking at today's, the ISO 15889, but if you look at a WHO or all models, they all sort of at the end, they all mention about these components. So let's ISO is one of the best models, not only because it will help us to build our quality management system, because a lot of the organizations that do today accreditation, they use ISO 159 to do accreditation. So in your countries, international organizations, they will use ISO with all guidelines to accredit hospitals or labs, hospital labs or labs, private labs, or specimen collection centers. And then another key component that we haven't spoken too much, we haven't discussed too much, but it's very key, especially for organizations with more than 5 people. And obviously a larger the organization, you want to have a quality steering committee where you have the quality, usually the quality manager, the quality individual is the chair of that committee, or it could be a chief of the lab, right? It could be a medical director, it could be a director of the lab. You can decide that internally, and you can have a co-chair as well if you need to. This person will, this committee will have representation, again, depending on the size of the lab, will have representations from each of the lab disciplines, and they will discuss on a monthly basis. So every 2 months, they will meet and discuss quality issues, errors, risk management, customer satisfaction, surveys, reagents, equipment, accreditation, multiple elements that must be discussed at a management meetings. This is the opportunity that you will have with your managers, with your employees, with your key leaders from each of the disciplines to discuss what are the main issues or what are the successful stories for each of your labs, if you're your disciplines. So this is a very important component. So I think I'm almost done with all the key elements that I wanted to bring to this webinar, and I'm gonna open now for Q&A. It's been great talking to you. I'm gonna open the microphones to questions and answers. I'm gonna let David come back and lead us with this part.
Wonderful, wonderful. First of all, Manuel, thank you so much. That was a wonderful presentation.
Thank you.
Very insightful. So we can definitely open it up for questions for the Q&A. So feel free to type in any questions that you may have. But first of all, yeah, I definitely, personally, I think I learned quite a bit. I think I see now that having a strong quality management system is definitely a win-win. The 12 quality system essentials, it's definitely essential. And of course, internal audits, that was, you hit some nice points on that. And of course, the holy book in the lab. People got to know what that book is now for sure, right? So that's definitely some nice things I learned here. So we've got the first question here. I'll just read it out to you. And it says, what is your opinion about the integration of ISO 15189 and POCT?
Very good question. So that's before that happened, ISO 15189 was version 2012, was just related to the lab testing cycle, pre-analytical and management requirements and technical requirements. With the new version 2022, ISO has integrated basically one of the ISOs that they had it separate. There was a separate ISO called 22870, right? That was the ISO related to only POCT testing. With the new version, as of December, this ISO has integrated a lot of those components into the new version, December 2022. They are giving organizations 2 years to transition from the current version to the new version. That means that changes will have to go progressively. They can't just go ahead and do it accreditation for this new version. But to me, my perspective for this is great. Why? Because when I go for accreditation visits throughout the world, in Canada or international, I see that a lot of people didn't have experience with POC testing. People didn't know that there was a separate ISO related to POC testing. And POC testing is becoming a very important element or component on testing in hospitals and labs. Why? Because it's a small device, can be done in a small location, it can be done in remote locations. There is not so much cost associated to maintenance of the equipment, to other elements. There are some things that people have to keep in mind, and people didn't know that those are the things. For instance, a lot of the things that we do with the equipment, with POCT or with the lab equipment must be done with also POCT equipment. Inter-lab comparison results, education, training. Those are things that were left on the side because they were not part of ISO 15189. They were mainly for lab equipment. Now, incorporating those components into the new ISO will ensure that any organization not only will pay attention to those large equipment, but also to the small equipment, regardless of the location where they are, small, rural, or a big hospital location.
Absolutely, yeah. We'll jump into the next question here, and it is, why is it important to report lab incidents and errors?
Well, thank you. That's a very important question. And I want to just summarize that learning is key. We must learn from our mistakes. If we report incidents and we learn from incidents, those incidents will not happen again. This is another one of the biggest issues that we encounter even in developed countries. Because of the culture, the patient safety culture, people are afraid of reporting lab incidents or hospital incidents related to medication, to diagnostic imaging. When it comes to lab, we must report, because every time that we report an incident, we learn from that. And we develop new policies and procedures and processes to avoid those errors to reoccur or to happen again. Reporting is a very important element within the quality improvement culture of any lab.
Yes. So here's a question on internal audits. We know they're important, but the question says, how often are internal audits, how often should they be done?
Okay, well, thank you for that question too, David. In 2012, and previous versions of ISO and even international organizations, they have recommended that it should be done on an annual basis. A lot of the wording today is more open, should be done frequently. My advice to you, coming from my experience as a lab scientist, manager, and director of labs, I would recommend you to do this on an annual basis, right? And you don't have to, if it's a large lab, you can pick from your quality management system for your lab disciplines, which of those elements you want to audit. That means, because sometimes it's a large lab, it's hard to have a quality audit every year, but you can pick annually what areas you would like to audit, right? And doing the audit is another element that we could discuss later. How do we do audits? Because you're not supposed to audit your own work because you are biased. So doing it in a smart way, you can ensure that it's done properly. So my advice at this point is to do annually, but select the areas that you like if you're not able to do a whole quality management system and all disciplines.
Mm-hmm. Okay, and to the last question we have so far, who should be involved inside and outside of the lab?
For what? For internal audits?
I'm not too sure, but I think maybe direct it that way when it comes to audits. Who should be involved?
Okay, yeah. So that's actually a very key element when you do internal audits. When you do internal audits, you want to have people who work in the lab but do not do the same testing. So that means if I'm doing biochemistry, if I'm going to do an internal audit, I will ask somebody from hematology to audit my lab in biochemistry. Even better, I can ask another lab hospital one of those referral labs to come to my lab and do an internal audit, right? So and externally, and you can do so you can do it both ways, because accreditation is when you have a set of people, a number of people coming from different hospitals, different private labs, and they assemble a team, and all those teams come from different organizations. When it comes to internal audits, you can do it with your own people, different disciplines, or you can invite another referral lab, another friend lab who can do the internal audit in your lab. I hope that answered your question. I'm not sure if it's related to internal audit, but if it's related, that's the way that it should be done. I see more questions.
Yeah, so there's one, we have, I think, time for one more question here. This one comes from a colleague. The question reads, different medical devices can share the same area. I would like to know, how is the installation requirements for the different medical devices regulated? Some installation requirements could be similar, but some could be different and have an effect on performance or expected results. Are changes to accommodate for each required, or is there a flexibility?
All right, let's see if we can answer this question to Gustavo Martinez. Gustavo, very good question. It's true. If I have an instrument in, for instance, I'm gonna give you an example of this that comes to my mind. Biosafety cabinet. A biosafety cabinet is an instrument that can be used when you're doing testing, a CSF testing in hematology, or as well, you can use microbiology testing in that same biosafety cabinet. So before you put in place that biosafety cabinet, you must ensure that it meets the lab needs, that is also a manufacturer, the manufacturer claims have been assessed, evaluated. So that's an instrument that is used for doing some testing. When it comes to some other testing, let's say a hematology analyzer or biochemistry analyzer, each of those instruments will have to be also validated and verified. We will run, depending on the lab, the test that we run on each of these equipment, we must do some specific studies. And that's where you need to meet with your biochemist in your organization and determine which studies must be run. For instance, if you're gonna do a chemistry result where you have quantitative results, you wanna check precision, accuracy, carrier, linearity, reference ranges, reference intervals. You want to check also the claims of the range upper limit, lower limit. So depending on what you do on that equipment, you must run the studies. And those studies must be run according to international guidelines, CLSI guidelines, for instance, one example, and you must document it and you must keep those records. So I gave you 2 examples of how to do that. If it's a minor equipment and it only gives you quantitative results, there are other ways to do that. For instance, equipment in pathology, there's different set of validation for pathology. That's why you need to meet with your team and you need to develop those procedures for each of the equipments that you have in your lab.
Thank you so much for that, for the question, and of course for the great answer there. So
any more questions?
I don't see any more questions of right now. I have one for myself. You did mention and discuss the laboratory testing cycle.
Yes.
Pre-analytical, analytical, post-analytical, and the percentage is so high where this pre-analytical section and transportation. So do you see any solution or how to counteract that? You know, because the percentage is so high there where things go wrong, right?
So I'm happy that you came back to this question. You went back to that question, David. It is definitely is really astonishing to hear that 70% of the lab errors happen before the specimen is analyzed. It's called pre-analytical errors. Unfortunately, some of these variables are not, the lab is not able to control. For instance, if you work in a hospital, the way that the nurse collects the sample, the way that the sample is transported into a lab, even if you work within the lab. But my experience with hospitals is that in hospitals, a lot of the people in the hospital, they are not educated the way that the lab is educated. Lab people will know the sequence of drawing samples. Lab people will know that it's very important how long to keep the tourniquet in your arm. How long, what's the best way to draw sample, right? A lot of the people who take samples in the emergency department are nurses or physicians that are rushing off. Sometimes they don't have time to count the time that you have the tourniquet. So, and sometimes they label multiple specimens. So you have pre-analytical issues such as mislabels, hemolysis, short samples, lipemic samples, samples that were delayed in transportations that were not, they didn't arrive on time. And when you analyze those samples, they're wrong. So that's why the majority of errors happen before the specimens come to the lab. What can we do? Number one, education and training. This is one of the biggest things that I do in my labs, where I have ongoing meetings with nurses and with other people who collect samples, and I present slides with my team as far as what's the best way to label the samples, to collect the samples, and to transport the samples to avoid those errors in the lab. So education and training is the key component. And I can see if somebody just say, agree with me on that. Education and training. Is that you? Oh, I think you just put it. Okay, good. Thank you.
Wonderful, wonderful. And thank you for the great answer. You did have your contact information up on at the end of the slide. But of course, if anybody needs any additional information, would like to contact you, Manuel, I think it's going to be back up on the screen there. Yeah. So your contact information is there. Of course, if you need to get a hold of Mr. Geraldo, you can of course reach out to Response Biomedical, and we can definitely connect you. But I would like to wrap it up at this time. First of all, I want to thank you again for the great presentation and the wonderful Q&A, and thank everyone for attending as well. We're just under the hour here, so I think we're pretty good here for wrapping up this wonderful webinar.
Thank you.
Thank you, Manuel, and thanks everyone for attending. Have
Thanks.
a good rest of your day.
You too.